Hi guys, Heather here. Today's video is about when your patient just isn't feeling well, just not feeling right, Or more specifically, maybe they're short of breath. This video request comes from Richie. Although I think that's how you say it, I'm not 100% sure. It could be Ricky. Well, I hope I got one of them right. Well, hi, thanks for the video request. So, if I had a patient that was complaining of shortness of breath, first I would go in there and check their O2 stats. Lucky for me, a lot of our patients are already on the continuous pulse ox monitors hooked up right at the bedside. How convenient. So if it's not beeping as loud as possible, then their stats are probably okay, hopefully. So if their stats are low, you might want to check the source, like are they getting enough oxygen? Because some patients like to take off their oxygen. Or if they're anxious, some patients get short of breath when they're anxious. Or did they just have an activity that caused them to lose their breath, like walking to the bathroom or getting off the commode, or some activity that made them short of breath? Some patients feel short of breath when they have a high heart rate, like a fast AFib due to higher oxygen demands. Like when you're running on the treadmill and you feel short of breath? That's kind of like how they feel, except they're just sitting there. Imagine how they'd feel if they were on the treadmill. Even a simple activity such as taking pills can cause some patients to become short of breath. And honestly, if I had to take that many pills, I would probably be short of breath too. Because unfortunately, we can't swallow pills and food and breathe at the same time. And unless you have some special power, I wouldn't recommend doing it because the results just wouldn't be good. So don't try it at home. So what can we do for these patients? Well, if their stats are okay, we can sit them up in bed because sitting up helps patients breathe better, make sure they have enough oxygen, help to calm them down, and if they need calming medications, by all means, don't stand in the way of that. Some patients need it. And if that doesn't work, we can always call respiratory therapy. After all, respiratory therapy is their specialty, and they can be your second set of eyes and assess the patient. Maybe they need a breathing treatment. And if none of that works, then it's time to call the doctor and see what they want to do. So if you have a patient who says they're not feeling well, try and get a better answer. Ask them questions. Ask if they're nauseated, if they're in pain, dizzy, lightheaded, whatever answers you can get from them. Of course, take their vitals and see if there's any medications you can give them for their symptoms. Sometimes you can just monitor the situation and the symptoms will kind of resolve on their own. I remember this one patient I had who was sweating and just says he wasn't feeling good. So, took his vitals are fine, we got him some ice packs, I monitored him for a little while, and eventually his symptoms just kind of went away and he was fine. Sometimes after surgery, patients feel lightheaded, dizzy, nauseated when they get out of bed, but once they're back in bed, the symptoms kind of go away, or sometimes, because of all the anesthesia and the medications, that it might take a little while once the medications get out of the system for the patient to be feeling better. But, it's kind of normal after surgery. Now, to scratch the surface of pain, if your patient's experiencing, let's say, abdominal pain, then you can ask them to locate it, describe it, and rate it using that fabulous 1 to 10 pain scale that we all love. If it's a new pain for the patient, you can mention it to the doctor. They might want to get an abdominal x-ray or something of that sort. But if you ever have any questions, you can always ask a coworker, charge nurse, or mention it to the doctor if needed. The great thing about being a nurse is you are not a one-man team. There are many people around you who can help you. Well, thanks for watching everyone. Have a great day and I'll talk to you later, okay? Bye!